Yeah, it's very, very important to know what stops the heart for it to restart, because there are so many conditions which stops the heart. First and the foremost and the most common thing that what stops the heart is ischemic heart disease, or in common terms, a heart attack. We tend to ignore this fact that one of the commonest presentation that is seen for a stoppage of the heart is the myocardial infarction, which is called in common term as heart attack, and that we fail to understand the concept of a heart attack and how heart attack is different from a cardiac arrest. So let me first differentiate between the heart attack and the cardiac arrest. Heart attack is basically a condition which can be life threatening and which is one of the causes for the cardiac arrest. So when there is a heart attack, 80% of the times they are the people who are prone for a cardiac arrest. The rest 20% are caused by various other factors in the form of prolonged QT syndrome, cardiomyopathies, myocarditis, heart failure. Then there may be other metabolic issues and cardiogenic shock and many other causes. So the heart attack is basically when there is reduced blood supply to the heart, sudden stoppage of the blood supply, which cuts off the blood supply to through one of the major blood vessel into a segment of the heart muscle, causing what is known as a major heart attack or a major occlusion in the blood vessel, leading to reduced blood supply and finally the death of the myocardial cells. So this is the heart attack. It can happen with various signs and symptoms, where some people will have chest pain, some people will have jaw pain, some of them they complain of left arm pain, some just have some sort of a presentation in the form of nausea, vomiting, and some do not have anything else other than giddiness. Some people also have an abnormal, especially women, they have an abnormal presentation in the form of generalized weakness. So we have to recognize them and we have to treat them. If the myocardial infarction is not recognized and treated, that is when they go into a state of cardiac arrest. So as I said, this is how we have to differentiate, and it is believed that 80% of those patients with a heart attack or a cardiac arrest, if when resuscitated and when putting back to normal state after the resuscitation or after the CPR or the restart of the heart, as we call it as, the chances of them to survive is 30%. So it is always better when you see a cardiac arrested patient to revive him as early as possible by a simple method which can be done by a common man or a layman or a bystander by a simple procedure called as cardiopulmonary resuscitation or a CPR. So this is the way we differentiate between the cardiac arrest and the myocardial infarction or a heart attack. Yeah, what happens during a cardiac arrest is very important. The heart literally stops functioning. So when the heart stops functioning, the rest of the body's organs also will stop functioning slowly but steadily. But if you are able to see it, witness it early and try to do a cardiopulmonary resuscitation at the earliest possible time, the chances of these patients getting complete recovery is more. So the early you identify these people having the cardiac arrest, and the early you try to put them back into a restarted heart, as we call it as, by doing a simple method of cardiopulmonary resuscitation, which is laid down. It's a clear-cut BLS recommendation where we take care of the airway of the patient. Then we have to look at the compression of the chest to pump in the stopped heart, and also ABC. Then we have to look at the third part of the component. So each of these things, airway, breathing, and the compressions are taken care in a fashion which has been learned by these the bystander or the layman by the proper cardiopulmonary resuscitation methods. Then I think we can save this patient. As soon as there is an improvement in this condition, he can be shifted to the nearby hospital once there is a complete recovery or when the heart restarts. So that is the beauty of the CPR. So CPR can be done not only by the trained personnel or the medical personnel alone, it can be done by anybody for that matter, provided they learn it in a proper fashion and also to know the importance of doing a CPR. How much of compression has to be given, what is the first thing that you need to do, how to identify these things, and these are all taught by the trained professionals in some of the well-trained academies which are available, some of the well-trained hospitals. There are some organizations of late which have come into existence. They train people. Any lay person, any layman can learn this cardiopulmonary resuscitation, and it is quite simple and easy. Yeah, I mean it is also quite common that many of these hospitals do not have adequate time to train the lay people. So there are many academies which have come up of late, and the VMeadow Academy, which I have seen, has been doing a great job by trying to reach up to the lay people, organizations, and some of the colleges and the small units which are come forward to take their help and get their people trained for doing a cardiopulmonary resuscitation. I think one such academy which stands out is VMeadow Academy, and it is good to see that this academy is doing a good job by training the lay people how to do a cardiopulmonary resuscitation. Why are we seeing young people falling prey to the cardiac events? That's a very important question. All of us think that heart attacks or the cardiac problems do happen only to the elderly people and the middle-aged people. That is wrong. It's a wrong concept. Of late, we are seeing a lot of young people falling prey to this dreaded disease entity which can be prevented, which can be controlled by controlling so many things. It happens simply because of the unhealthy eating habits, unhealthy lifestyles, lack of sleep, lot of stress which is quite common in these days, and no exercise, which is very commonly seen in today's youngsters. So these are the important, and eating unhealthy food is the most rampant thing. And the other causes are like smoking, too much of an alcohol intake, and all these things, sleeplessness. These are some of the important things why we are seeing many youngsters falling prey to that. And it's more so in the IT professionals because of the fact that they have no proper working timing and the sleep disorder because of their working overnight on par with their Western counterparts. That's one of the major reasons. So all these factors do play a lot of role. So if somebody wants to change this, they have to eat healthy, sleep healthy, and have a healthy lifestyle. And it is very important for them to follow a regular exercise, which can change things. And smoking is a very, very important risk factor which has to be addressed, and there is no alternative but to quit smoking. Alcohol in moderation is only allowed, but if you cross certain limit, that can also be dangerous. So this is the exact reason why many of the youngsters are falling prey to the cardiac arrest and cardiac related problems. Thank you very much.
Thank you.
Have a nice day.